A major cause of miscarriages. What causes abortion? In this lesson today, I'll be teaching you one of the most common cause of miscarriages or abortion. You know, abortion is the interruption of a pregnancy before age of viability, or the loss of a pregnancy in early age is known as abortion. Now, there are different types of abortion: induced abortion and spontaneous abortion. A lot of women prefer to refer to this spontaneous abortion as miscarriage, meaning that miscarriage is abortion. Miscarriage is a particular type of abortion which occurred without you being the cause. You do not have the intention to terminate a pregnancy, yet you'll get a pregnancy. It might be a very precious one you have been praying for, and it has come, and before you know it, you start feeling pain, lower abdomen from the waist. Before you know it, you start bleeding, they rush you to hospital, and then you end up losing the pregnancy. A lot of women refer to that one as miscarriage. Yes, it is abortion. When you say miscarriage, you are referring to spontaneous abortion, the one that your hand is not there. But the bottom line is that the pregnancy has been interrupted, has been lost. Now, why is it that some women, a lot of women, have recurrent abortions or recurrent miscarriages? 2 times, 3 times, 4 times, get pregnancy, it is 2 months, 3 months, it's gone. What is a major cause of this? There are several causes, but we are going to target this. Rhesus factor incompatibility. Do you know that a lot of women don't even know their blood group and the rhesus factor? Do you know that women get pregnant and they are even attending antenatal clinic before they discover their blood group and the rhesus factor? Now, there are 4 blood groups that every human being has. You either have blood group A, blood group B, blood group AB, or blood group O. So there are 4 blood groups: A, B, AB, and O. But there is something hidden in the blood groups that was discovered by Rhesus, Dr. Rhesus. That is somebody's name. And that is why that factor was named after him. Some blood groups have this factor. Like blood group A may have that factor present. Then we are going to tell you that this blood is blood group O, rhesus positive. If this factor is not there in this blood group, we will tell you that this is blood group A, rhesus negative, meaning that the factor of rhesus is not there, is absent. So it is either the factor of rhesus is present or it is absent in any blood group. So if you are blood group B, we will need to find out if the rhesus factor is present. If you are blood group AB, we need to also find out if the rhesus factor is present. If you are blood group O, we need to find out if the rhesus factor is present. Those who do not have the rhesus factor, they will only mention their blood group and say rhesus negative. Negative means absent. Ladies and gentlemen, where then is the problem? A woman who bears the pregnancy and does not have rhesus factor could be a problem where the husband or the partner has rhesus factor. Listen to me here. A woman can get pregnant if she is rhesus negative, Maybe she's blood group A, rhesus negative, or she's blood group O, rhesus negative. As far as the woman is negative, rhesus factor negative, she needs to think about the man that has to get her pregnant. This is one reason every woman needs to go for pre-conceptual care, so that they determine this even before you get pregnant, so that you know whether your partner is also rhesus negative. A woman who is rhesus negative needs a man who is also rhesus negative. She will never have a problem, and she will have her babies without a problem. The problem comes when the woman who is bearing the pregnancy is rhesus negative, but the husband is rhesus positive. The baby that you carry, the baby the woman is carrying her womb, has inherited the rhesus factor from the father. Therefore, baby with rhesus positive is growing inside the womb of a woman with rhesus negative. The system of the mother now sees the baby inside the womb as an antigen, as a disease, as an enemy. So the system of the mother, which is rhesus negative, embarks on producing antibodies to destroy the baby in the womb. Luckily, it takes time, even more than 9 months, to produce enough antibodies to destroy the pregnancy. This is why first babies usually survive. A lot of women will carry their baby, the first child in life, till 9 months until they give birth. But it shall be very difficult to have another pregnancy and keep it. They will be coming and you have miscarriages, recurring miscarriages. Yes, because the system of the woman had already produced enough antibodies to fight any rhesus positive baby. So anyone that will be coming from the father will inherit the rhesus factor from the father, and it becomes a problem. Please go to the hospital, know your blood group and your rhesus factor. This problem will be solved. You will not be having miscarriages again. They will show you how it can be managed. It is in a different video. Our next video, I'll be teaching us on how they can manage that kind of situation so that the woman can continue to have babies without problem. My name is Dr. David Ayim, your reproductive health expert, and of course, I hold a PhD in public health. Please subscribe, like, and share. My contact 674-605469. If you are out of Cameroon, please start with +237. Thank you very much.